do not have the clicker. Okay. Oh, here it is. Here's the clicker. All right. All right. The podium does not like my phone. So, disruption in healthcare is a big topic, and when we talk about disruption, everybody and their brother wants to talk about their startup as being the one that's going to disrupt this industry. And the term is drastically overused. But on the other hand, when we have real disruption occurring, there's nowhere that's more welcome than in the healthcare sector. And disruption is so welcome in the healthcare sector because when you have an advance, what it means is people who would otherwise die get to live. Or people who would otherwise be terribly disabled get to live normal lives. It's a tremendous value, a kind of value that you don't get in a lot of other sectors. But as I think everyone in this room is already aware, there are some real obstacles towards medical progress. And what I would submit to you as we begin this presentation is that regulators and regulation are essentially the anti-innovation. And they are the ones disrupting the disruptors. But good disruptors are out there. And I'll tell you a story about one of them, and then we'll talk a little bit about the nature of disruption in the healthcare sector. So, one of my slides is missing. But I would say that I would call your attention to the image of Kim Jong-un, the dictator from North Korea. And Kim Jong-un is very fond of having himself followed around by lots of sycophants who carry notepads. And everybody takes notes on everything Kim Jong-un says, and he will be inspecting a factory or inspecting a farm or inspecting a hospital, and people will take notes. There's a reason for this. It's because when you want to create the air of authority, you have to create the air of being extremely wise. You have to pretend to be wise even if you're not wise. And I would argue that this is the regulators. So Rocket Man is really the quintessential regulator. He purports to be very wise. He is in fact very violent. And this is how he goes about his daily life. Now when we talk about regulation, there's a theory we have to be very well aware of, and it's the bootlegger and Baptist theory of regulation. This theory came out of the United States in the era after Prohibition. And for those who don't know, Prohibition was a very sad period in the United States when we outlawed the sale, consumption, distribution of alcohol. And that was supported by a coalition of people. It was supported by Baptists who believed it to be immoral to consume alcohol. And then it was supported by bootleggers. They were people who profited off of Prohibition. They were the people selling the alcohol on the black market. And they didn't want it to become legal because that would threaten their black market windfall profits. In medical regulation, the bootleggers, at least to me, are very obvious. They're politicians and regulators who have a selfish incentive to grow their own prestige and to be risk-averse in terms of what types of experimentation and drugs they allow to be approved. And this is pretty much true throughout the world. And so they have a selfish incentive to hold things back because nobody really ever gets after them for holding things back. But if they do let something through that turns out to be harmful, they may pay a very severe price. But who are the Baptists? Well, the Baptists are the people who are out there saying we need these regulators to protect us. We need the state to come in and protect us from unscrupulous businessmen. And I would argue that the Baptists, in terms of medical regulation, are sheep. They're people who are following false authority, and we should be very skeptical of the claims they make. So I'd like to tell you a story about my own health. This happened to me just a few months ago. I was having some odynophagia. And that means that I was having pain when I swallowed. And so I had a procedure called an EGD, which is a procedure where a camera is inserted into my stomach to look around, and I had a biopsy. And I was diagnosed with something called H. pylori gastritis, or Helicobacter pylori gastritis. Helicobacter pylori is a small spiral-shaped bacteria that is known now to cause ulcers, inflammation, and cancer in the stomach. But it wasn't always known to do that. And in fact, in the early 80s, and prior to that, it was believed that stomach ulcers were caused by stress. There was evidence that they were caused by H. pylori, such as autopsy series that were published documenting extremely high rates of H. pylori infection in people with ulcers. But a couple of doctors, a pathologist and a gastroenterologist from Australia, got together. Their names were Marshall and Warren. And Doctors Marshall and Warren came up with the hypothesis that ulcers were probably caused by H. pylori bacteria. And they had a very difficult time getting the scientific community to accept this. And they had papers that were submitted and rejected and rejected and rejected. They were simply laughed off. And we have to understand this in the context of the political climate of the time. And when I say the political economic climate of the time, because there were some very powerful interests involved in maintaining the status quo of the treatment of ulcers. So there was a medication called Tagamet that if you had an ulcer, you basically had to take for your entire life. And these people were powerful and influential. And so the first thing that I would say was disruptive is that Dr. Marshall prepared a broth of H. pylori from a biopsy specimen, and he drank it himself after proving that he wasn't H. pylori infected. And he proceeded to develop gastritis, and he got very sick, and then he took antibiotics, and he got better. This was a watershed moment, or at least it should have been. It's pretty amazing, number one, when someone experiments on themselves, but number two, this is actually the model we use for determining that a microorganism causes disease. We take somebody who doesn't have it, we expose them to the disease, they have it, we treat the disease, it goes away. This is strong evidence. It should prompt further studies. It should prompt introspection. And another piece of information that should have prompted introspection is that at the time it was known that a medication called Pepto-Bismol, or bismuth subsalicylate, it's a pink medication you drink for indigestion, was toxic to the H. pylori bacterium, and would result in a cure in about 30% of ulcers, where you wouldn't have to take the medication anymore. It wasn't a mainstream treatment, but it was known, at least to the people who were looking into this very deeply. But, unfortunately, Doctors Warren and Marshall continued to be ignored. And they were ignored for almost a decade until, as Dr. Marshall describes it, he started going to the United States and getting lots of publicity. And the publicity was interesting because he was covered in media like the National Enquirer, and he was covered on television. This wasn't the medical press. And he had, at the time, no idea why. But he later learned that the drug makers, Procter & Gamble, who were the makers of Pepto-Bismol, had a public relations firm by the name of Hill & Knowlton. And they were the largest client of Hill & Knowlton. And somehow Hill & Knowlton had taken an interest in this crazy doctor who had experimented on himself. And what it turned out being was that Hill & Knowlton was pressing this story to the media. They were promoting it. For those unfamiliar with US law, it is a crime, a federal crime, to promote a medication for an off-label use. What Hill & Knowlton was doing was promoting Pepto-Bismol for the use in ulcers, and it was not approved for this therapy. What it means is that Procter & Gamble were committing a federal crime, and it was precisely because Procter & Gamble committed this federal crime that a sea change in medical therapy occurred, and we began treating Helicobacter pylori as the infectious disease that it is. We began eradicating the H. pylori infection and experiencing tremendous benefits for our patients. So Dr. Warren estimated that the total ulcer population in Australia was reduced by 70%. 50 to 95% of malt lymphomas, a type of stomach cancer, actually get cured if you just treat the infection. And in my estimation, 2 to 3 million people experience a tangible benefit every year due to the work of Doctors Marshall and Warren. But I want to be very clear. Dr. Marshall and Dr. Warren were not the disruptors here. The disruptors were Procter & Gamble, who violated the law in order to bring this knowledge to all of us today. I wish that there had been other people like this willing to violate the law, because in the 1960s, Squibb Chemical Company became interested in aspirin for heart attack prevention. We all know today that aspirin's a great drug for heart attack prevention. But again, due to US FDA regulations regarding off-label promotion, it was not pursued until about 1989. And my colleague, Dr. Mary Ruart, who couldn't be here with us this time, but she has a wonderful book out called Death by Regulation, estimates that 1.7 million people died prematurely because while scientists knew that aspirin could prevent heart attacks, the general public didn't, due to FDA censorship. If someone at the Squibb Chemical Company had been willing to break the law, they could have saved millions of lives. There are some other lawbreakers that I want to call your attention to. And the first is a company called Rational Vaccines. They haven't been as successful as Procter & Gamble was in terms of disrupting. But to conduct a clinical trial on a vaccine in the United States is a tens to hundreds of millions of dollar endeavor. It's very difficult. And we have had multiple companies attempt to create herpes vaccines in the United States only to stop their development attempts, citing the fact that it's not financially feasible to go through the process. In principle, there's no reason why you can't make what we call as a live attenuated virus for herpes. It's very easy to do, and there's no reason to believe it wouldn't work. In fact, we have a live attenuated vaccine for varicella, which is a virus from the family of the herpes virus. So Rational Vaccines, which is founded by some Silicon Valley investors, got a doctor who was willing to go overseas and bypass the regulatory hurdles. They decided, hey, if it's not viable as a business to follow the law, we'll find a loophole. We'll go overseas. And we won't have to get an institutional review board. We won't have to get FDA approval. And we will just conduct a trial. And so they did. The only problem is that the lead investigator died shortly after the trial was undertaken. And later we found out that he was actually terminally ill when he began the trial. But if you talk to the person who, to some of the patients who experienced the trial, what you will find is that they benefited from this. So these are people in the trial who had severe problems with herpes, far more than most people, with frequent outbreaks. And in this case, this patient, whose photo was on the previous slide, said that his herpes outbreaks were occurring 2 to 3 times a month, despite the fact that he was taking antiviral medication. Oh. Does it work?
This we turned on.
There we go. All right, yeah, this is better. All right, so 2 to 3 times a month he's having outbreaks, and then once he's been undergone the trial, he had 4 outbreaks in 4 months, and all of them were mild instead of his usual 8 to 12. So he believes very strongly that this vaccine trial helped him. But the unfortunate thing is that this trial was decried as unethical, and the media really tore these people up. They said you're defying U.S. safety protections for human trials. They're putting the university's funding at risk. When you step back and look at what happened, you saw the lead researcher, knowing that he was terminally ill, and knowing that in the current environment there would never be a therapy developed because it wasn't viable. And he said, you know what, I'm dying, they can't do anything to me. So he went out and he violated the law. He actually administered a lot of the booster shots for the vaccine in the United States in direct violation of the law, knowing that he was dying and it didn't matter. We haven't gotten anywhere with this yet. It hasn't borne fruit, primarily because the lead researcher is dead. But what we have done is shown a lot of people that medical research can happen and can be viable for diseases that are right now not viable if we just somehow find a way around the regulatory structure. So this is the lead investigator. Ultimately, I would just want to point out here that the only real criticism of this whole trial, besides the fact that they didn't ask permission from their government overlords, is simply that the lead investigator died. If the legal structure weren't such that no person who isn't terminally ill would be willing to do it, we'd have a different kind of outcome here. I'll point out just a few other medical disruptors. One is Liz Parrish, and she has a company called BioViva that is promoting gene therapy. in the United States, but she actually went abroad to be the first patient in a clinical trial of her gene therapies for anti-aging purposes. It was not possible to do it in the USA, so what she did is she found a location where it was possible. There's a group of biohackers, is what they call themselves, and they're creating artificial pancreases, and actually this is going to go commercial. And what they realized is that if they are hacking their own bodies, none of the laws apply to them. So they found a loophole. And they formed a community, they all worked on this together, and they developed this to such an extent that now companies that do comply with the law are taking a lot of their innovations and bringing them forward. Now, if you have severe type 1 diabetes, within a couple of years, you'll be able to have an artificial pancreas. It will be the first artificial human organ. And it was developed by technology of individuals hacking their pancreas, or hacking their insulin machines in their garages. It's pretty amazing. There are several people out there working on gene therapy for HIV. In principle, if you understand the molecular targets they're going after, there is no reason this shouldn't work. And they're injecting themselves, and so far, to be fair, their experiments have not yielded fruit. They also haven't harmed themselves, but they haven't yielded fruit. But I am very optimistic that we could actually see what we call as a functional cure for HIV, and I don't mean a cure, but a functional cure. We could see that coming from someone's garage or someone's basement, and then being available overseas in some place like Colombia or Mexico, while not being available in the United States. Organ traffickers are another example of people who are trying right now to disrupt the current medical regulation, and my colleague, Professor Schoolin, is going to talk about this issue. But these people often end up in prison, and I would say that the mistake they're making in terms of the disruption they're doing is that they are not trying to find a way to scale what they're doing. They are pure black market actors. They're not trying to find a way to improve that. If the organ traffickers find a country that will allow them to perform organ transplants for money, or if they build a floating hospital, they will take that leap from black market entrepreneurs to disruptors. I would be remiss not to mention Ross Ulbricht, who did actually try to create a much safer form of black markets with his Silk Road marketplace. And as we all know, he is currently being held captive by a criminal gang as a result of that. Finally, in my home country, we have asynchronous telehealth developing. And what asynchronous telehealth is where you would fill out a questionnaire, it would be sent to a doctor, and they would write you a prescription. And this is for erectile dysfunction drugs like that Viagra. The really cool thing about this is that a lot of people have a lot of shame issues regarding this, and they don't want to talk face-to-face with their doctor. So these questionnaires are great. The problem is state medical boards don't consider a valid doctor-patient relationship to have been created by these types of asynchronous platforms. And what we are seeing with these disruptors is that they are trying to do it anyway. They're recruiting doctors who are willing to write the prescriptions even though they're not necessarily legal. And what they're trying to do is get so big and so powerful so fast that the state medical boards will not be able to come after them politically. And this is a lot of I would argue what we saw with Uber, where in many cities they said, oh, it's illegal to drive for Uber? Well, that's okay, we'll pay the fines for our drivers. And we're gonna get so big in your market that our customers are gonna put so much pressure on you, you won't be able to fight us. And in some places, that's worked very well. And in other places, like in France, some Uber executives are in prison. The point I would make here is that if you want to have a really meaningful disruption, it's not just by developing a new technology, it's by breaking through an old paradigm. And in the world we live in today, with regulators, it means law breaking. There is nothing moral about law. Law is a written threat from politicians. And so what I would argue is that you must have a well-developed sense of right and wrong, and that should guide your conduct. And illegal and legal should also guide your conduct, but only in a very utilitarian way. And there are people out there who are in a position in life where they can do disruptive things. Maybe they're just a risk taker who's willing to take big risks, like Ross Ulbricht. Or maybe they're terminally ill and willing to make a point on their way out. Or maybe they have a lot of money and they want to put it towards something important. And these are the real disruptors. And if we want medicine to move forward, and we want more cures to be available, so that we live longer lives, so that our loved ones don't die prematurely of diseases that should be curable, we've got to look to these people, the real heroes of entrepreneurship, who are both capitalists and criminals. Because criminal is a word that, in the context of the world we live in, is applied by governments to people who don't accede to their threats. And I would argue that when we're talking about medicine and we're talking about healthcare, we should be courageous and we should stand up and we should look towards the future where we can have tremendous advances. So with that, I'd like to hand the podium over to my colleague, Dr. Schooland, who is going to talk about a very interesting topic.